Hey guys, I'm Dr. Elizabeth Boggier. I'm the owner and the CEO of MountainView Veterinary Hospital. We're located in Denville, New Jersey. And this is Christy. She's my right-hand person. And she is our manager for patient operations. And she's going to be giving me a hand with some of the information that we have to give to you today. Hello. And let's see if we can get you guys a little bit more informed on what you might be able to do to help your senior pet live longer and happier. Next slide. So what is a senior pet? You know, we have these different, there is no cookie cutter answer to that. As a general rule though, dogs that are over 7 years of age are considered a senior. Cats who are over 10 years of age are considered seniors. However, keep in mind, for instance, I saw a Great Dane the other day who was 5.5 years old, and that dog is in his senior years because of their life expectancy. If I saw a Siamese who was 12 years old, they may still be in their adult years because those guys have a tendency to live forever, thank God. Just keep in mind, please, that aging is not a disease. It's a stage of life. It's very natural, and there's lots that we can do to make sure that these guys feel comfortable well into their senior and geriatric years. The first thing we want to talk about is mobility, because that comes up time and time again from clients, and I think that there's some misinformation about what aging means to an older pet and how these mobility changes affect them. You know, the major signs would be slowing down. They're not quite as quick to get up when you call them. They think about it before they need to rise. I'm talking about both cats and dogs. Certainly difficulty with the stairs. I didn't even realize that my own cat had arthritis until my daughter pointed out. She's like, look at Manfred. He's taking one step at a time as he goes down. I'm like, oh my God. So things to watch out for. Stiffness after rest. If you have somebody who like is stiff in the morning but then kind of gets out of it, that's another indicator that we're having some mobility problems. And of course, reluctance to exercise. A dog that used to go a mile or two, and now, you know, half of that time they're turning around, they want to come home. I did want to mention here that I've gone to, I do a lot of webinars, or I attend a lot of webinars as well. And I went to one recently put on by Lap of Love. Lap of Love is a company that does home euthanasia. And what struck me the most at that webinar was they said the saddest part that they see is coming in to help this pet transition. And there's so much that could have been done prior to them going there. So these pets could have been far more comfortable for a lot longer before they had to come to that decision. So that's one of the reasons why we're here, in order trying to help you guys to identify these types of things.
Yeah, and it doesn't come on overnight. I mean, you're going to see small changes, more days where it's a little bit more difficult for them to get around. And sometimes just keeping track of that, like how many days per week you see something like that, can make a big difference for what you can report in your exam.
Because it's so gradual. There's lots that we can do as far as supporting mobility. Now, I'm just going to touch on a couple things here. Pain management is my second love. First love is dentistry. And pain management is important to me because it's life-changing for them. We can see when a pet comes in that they're uncomfortable. Owners aren't sometimes aware of what they're seeing means that they're no longer comfortable. There are many joint supplements that are out there. One thing I do want to mention is not all joint supplements are the same. You want to make sure that they have been certified, you know, not kind of like a Facebook ad that comes to you because you've been searching, you know, pain in pets and that type of thing. Omega fatty acids are very, very good for pets, not only for things like osteoarthritis, but inflammation in general. So if you have a pet that has skin problems or a pet that has kidney disease, these are all inflammatory conditions, and they are natural anti-inflammatories. Again, not all omega fatty acids are the same. You can't go to Costco and get the thing that says omegas, because those aren't necessarily the types of fatty acids that we need in order that will help a pet. Probably my favorite, no plug, we get no discount, nothing like that, but I like Nordic Naturals. It's a very pure product. It's not necessarily inexpensive, but you know what? The research goes into play with that, and making sure that it's pure comes into play with that too. But Nordic Naturals, the pet version, is also very, very good, and it's what I give my pets. Glucosamine chondroitins. All right, so Very quickly, I'm just going to touch on this because I talk to every client about it. Cosequin. Many people know about Cosequin. It's been around for decades in the veterinary field.
Yeah.
Started out with horses and then other animals, and over time, that was glucosamine chondroitin. Over time, we realized that now green lip mussel and Perna caniculus and MSM, all these other different things were also helpful. So then their brand started to change a little bit. So now Cosequin is also Dasequin, and Dasequin also has many of these products as well. They have a new product out called Dasequin with eggshell membrane. Super, super product. It actually has some anti-inflammatory properties to it, which has not been something that we've seen before. There's also a new product by Verbac that I'm currently researching. So again, I don't want you guys to think that I'm plugging different products. I want to give you options of things that I've tried and that I know have helped in my own pet or my clients.
Yeah, I mean, I think also as far as the pain management goes for a prescription, some of them can have some side effects, and that's why we track blood work and things throughout the course of the year. But a lot of times using some of these other methods, the joint supplements, weight management, these can prolong the time before you need to start using something like a non-steroidal anti-inflammatory. So it all, and there's nothing wrong with using them when they're needed, but there's a lot of times we can prolong that so that maybe we can put off having even the risk of those side effects for a longer period of time.
Did you want to talk about some of these guys that?
Yeah. So, I mean, we have a pet named Lacey. I mean, she is 4 years old and she's around 80, 85 pounds. She had early onset osteoarthritis, and the owners were, wanted to do whatever they could for her. So they initially started out putting her on a non-steroidal anti-inflammatory and looking into some of the other therapies that we have. We have some injectable medications that pets can take, as infrequently as once a month once they get going with it. She started on one called Adequan, and she also started a high-quality glucosamine and chondroitin supplement, Dasequin, that we have. After, about 2 months or so, they were able to wean her off completely off the non-steroidals, and so now she just gets her monthly injection. Maybe I think it's monthly, and she's on the supplement. So I mean, at this point, we're hoping maybe it'll be a few more years before she needs to go on a non-steroidal. We have another patient. Her name's Riley. She has breed-specific issues concerning mobility. So whereas maybe your typical dog isn't going to see osteoarthritis until closer to the senior years, because she's a type of bulldog. Sometimes their conformation just lends them to having earlier onset, issues as well. This owner does a combination of different therapies, bringing her in for routine acupuncture. She gets laser treatment. She does supplementation as well. She also has some home modifications where she gets ramps and stairs. So just a couple ways that she's able to kind of, use a variety of methods to just promote as great a quality of life as she can for as long as she can by just using different methods. Not, one thing doesn't always work perfectly for one pet, but together they seem to help a lot, a lot more than they would on their own.
I also want to mention rehab, because there are some things that can be done that you can do at home in order to help strengthen these guys. Typically, by the time we say to you guys, all right, I think this pet is uncomfortable and we need to start working on some mobility, we need to start working on strength, those guys have already lost muscle mass, and there are some things that you can do at home in order to help increase that muscle mass. There are a couple of rehab facilities that are in our location. They've been fantastic. They use all different kinds of modalities. They use these Benny balls, and they use swimming. They have a lot of different things. Plus, they give you some tips and ideas that you can use at home. So other than going there, you're also able to help your pet while they're with you every day. Also, when you talk about rehab, we have laser therapy. Laser therapy is fantastic. I can't tell you how many patients we've had who have, let's say, a blown out knee, and either surgery is not financially possible, or the pet is much older and it's just not surgically a surgical candidate. Oh my gosh, with some laser therapy, putting them on a non-steroidal and some supplements, we can get those dogs not just better, but active, and that's huge. let's see, the physical therapy, the prescription pain management, we talked about that. Weight. All right, guys. We all know that food is love. However, keeping your pet on the leaner side is so much better for them. I had a Rottweiler who was 30 pounds overweight. The owners were able to get all the weight off of him. He was off of the non-steroidals. He was only on good quality glucosamine and Bidritin, and it was life-changing for that dog. So little things make a difference. Even if your pet's 1 or 2 pounds overweight, it still has all that pressure on their knees. It's putting pressure on their shoulders because they're shifting your weight forward to take pressure off the back end.
It isn't like 1 pound, like 14 pounds or something.
I forget what it is, but it's dramatic, like how much pressure you're putting on the knees. So we have all kinds of things, and these is what we want to open up your minds to, because it's not just, here's your pain medication. This is what we did years ago. And the dogs felt great, fantastic. But other than prescription medications, there's a lot that we can do to keep your pet healthy
now. Before we start section 2, did anyone have any quick questions on the previous section? No? Okay. All right, we'll carry on, and you can ask them at the end. Thank you.
The next topic that we're going to be talking about is early detection. So if you've been coming to our practice, you know that we have wellness panels. And we've negotiated a deal with our laboratories so that we can do these wellness panels on a reduced cost, so that we can identify early kidney disease, early liver problems. There's a lot of things that we can identify before they become a major problem and then start to intervene. Just as an example, kidney disease. The earlier kidney disease is diagnosed, both in cats and dogs, the better it is for the pet. Because at that time, we can monitor their blood pressure, we can make dietary changes. That gives you years of good quality life, as opposed to, you know, not having that information until they're currently in kidney failure. I know I'm focusing on the kidneys a little bit, but here's the thing. With lab work, only 70% of the kidney needs to be non-functioning before you see elevations in lab work. Urinalysis is a different subject, but again, this is the reason why these early detection early detection is so important in that. In senior pets, we do recommend twice yearly exams, and that's mostly because pets are aging completely differently than us. You know, we have clients who come in and they're like, well, I was here last year. Well, that's like 7 years ago to a person. I mean, we're extrapolating here, but it is a significant period of time. So every 6 months is a good idea to bring in your seniors. Hey, you know what? We do a physical and they look good. Great, fantastic, great. We move on to the next 6 months. But if we're starting to see some changes like weight loss, their coat is unthrifty, you know, we recognize dental disease, things that we can identify early in them and then do something about will then, of course, extend their life expectancy, which is what we want, good quality life expectancy. The other issue with twice yearly exams, we can track subtle changes. So, for instance, we might palpate the muscles in a dog that winds up having an issue with their knee or their hips, and the muscles palpate. Now they're within normal limits, but then over time you can notice that they're starting to get atrophy. So even long before the owners may notice that there's a difference, we're recognizing that difference in the physical exam, and it's something that we can start. I mean, hey, we need to address this. So what we do at each visit, we get a weight on them. You know, that is hugely important, monitoring their weight. And if you have a cat, I would recommend that you weigh them once a month. So if you have a home scale, just pick them up, weigh yourself. You don't have to tell anybody. And then you pick up the kitty and then you subtract. Because subtle weight changes in cats can identify an underlying problem way before you really think that you're seeing an underlying condition. Heart and lung function, a new thing that we've added to our feline wellness panels is something called a cardiac pro-BNP. And this measures cardiac stretch and identifies heart disease in cats way earlier than before they're having symptoms, or if they are starting to get significant enlargement of the heart. So we've now put that in panels. I think they're over 3, I want to say.
Yeah.
Because these are the silent killers. You know, these are the things that we get a call from an owner and it's a 7-year-old cat and they woke up and it had passed away. Those are the cats that have things like restricted cardiomyopathy, you know, things that didn't show any symptoms at all, but perhaps we could have identified it with having one of those enzyme tests. Oral health and dental disease, I think we're going to talk about that a little bit later. The behavior and cognitive changes, we're going to talk about that a little bit too. Christy, did you have anything else as far as the twice yearly exams?
Just to point out that, we have something called a reference range when we're doing blood work. We have something similar. The doctors have an idea of what they're sort of expecting to see. And sometimes your pet may still be falling in what might be fairly typical, but for your pet is not typical. So that's why those subtle changes are important. So a single visit or one set of blood work or one exam, may not seem like that there's anything to be too concerned about. But when we're comparing, that's when we get the most value out of, repeated blood work, repeated exams. Those little changes just make a big difference in what we can act on, sooner.
Exactly. That's the key. Early detection is the key. So recommended senior screening. So of course, lab work, we do recommend, and the panels that we recommend for wellness will vary. So for instance, if you want a full panel on your 2-year-old dog, that's great. We'd be happy to accommodate you. However, to try to accommodate as many people as possible at the lowest cost that we can, we'll have like a certain number of tests that are done on pets that are 3 years and younger, and then it goes up from there. Urinalysis, we kind of touched on that, right? In the urine, we will see those changes far before you will see changes in the blood picture. The other things we recognize on urinalysis is protein loss. So there are conditions where the body starts to lose protein. That protein can go into the gut, that protein can go into the urine, and the pets don't show overt symptoms for years. So these are, again, some of the things that we'll monitor as far as trends. And if we identify them, then it's something that we can continue to monitor. Blood pressure is also very important. Once we started doing blood pressures on a regular basis on our pets, we're realizing now that there's a lot of pets that are either borderline or certainly hypertensive. When I've been in the profession for about 100 years, and it wasn't unusual for a pet to come in and they're completely blind. And that can be associated with hypertension, high blood pressure. And that high blood pressure can be caused by a variety of things, including kidney disease. But now by our routine screening, we can say, all right, so now we know that this is trending upward, trending up. They've always been at this value, and now it's going up and up and up. So those are things that we can manage long before they lose their sight. Also, hypertension or high blood pressure has an adverse effect on the kidneys. So then it makes the kidneys worse over time too. And then imaging, x-rays and ultrasound, when we need them, these are very valuable tools, particularly in certain breeds such as German Shepherds, Golden Retrievers, Rottweilers. These guys are all prone to a particular type of cancer called hemangiosarcoma. Hemangiosarcoma literally goes undetected until it is so bad that it's making the pet very, very ill. So doing kind of routine screening as far as that's concerned also can make the difference between a pet that you have that passes away at the age of 8 or passes away at the age of 14. CDS. CDS stands for Cognitive Dysfunction Syndrome. And it's, we have compared it to Alzheimer's in people. And Alzheimer's, of course, is a very complicated subject. CDS is a very complicated subject as well, and it can be very difficult to diagnose. Previously, we had no way of identifying dogs that are starting to have signs of senility or cognitive dysfunction. Now they've come out with an assessment, and we're going to show that in the next screen, but it has to do with disorientation. And let me give you an example. I just had a dog come in recently. It's a geriatric dog. The pet is now vocalizing all night long. They're walking around the house, urinating, defecating in the house, goes outside, doesn't seem to remember what they were doing, sometimes gets startled by the owner. They don't even recognize them. These are some serious signs of CDS, but there's more subtle signs that you can see beforehand. There are some medications and diets that can be used in order to help stave off CDS if that's what we come to a diagnosis with. Barbara, if you can go to the next slide. So these are signs to watch for, and they use the acronym DISHA. The first one is disorientation. So if you have a pet who normally knew the house, been living in the house for 12 years, and never had an issue, and then suddenly they're kind of getting stuck in walls, or they don't remember which side of the door opens. that's something that you go, whoa, there might be a problem here. Interaction changes. You can see less interest in the family. Like they were always, you come to the door and always like, hey, I'm so happy to see you. But now they're a little bit more subtle. Some dogs can become very agitated. Anxiety problems can get significantly worse as well. You can also start to see some things like depression in them. Sleep disturbances, that's huge. We get calls all the time from clients who are like, the dog is waking me up at this hour, that hour, I can't sleep, I'm losing my mind. That can be another indicator of cognitive dysfunction syndrome. But it's important to have that checked out because that could also be a symptom of things like underlying pain. House soiling, pet that's never has been totally housebroken its entire life and is now, let's say, dropping stool in the house, or will urinate an entire flood in the kitchen, even though you just let them out, 2 hours beforehand. That's another big indicator that we might be dealing with this condition. And then, of course, activity changes, which those types of activity changes could be a little bit difficult to tease out as to whether or not it's something like CDS or pain, because they can get very restless. They're constantly pacing. They're whining. They can whine for no reason. And, something's going on here, but you can't really identify what it is. A physical exam and a thorough history will help us to help you to identify whether or not this is something like cognitive dysfunction syndrome or if this is something that's pain related or from some other condition. Brain health. There's so much that's going on now with CDS. You were mentioning there were some cases that you had remembered.
Yeah, so we have a patient who's, we'll call Zach, who's 12 years old, and the owner started seeing more issues at night, kind of wandering around the house, not sleeping through the night, just seeming like also just sort of staring off into space. I think at first she thought it was maybe more like that we weren't seeing as well or hearing as well. And we can tell in the exam, like, are we getting a response to sound? Are they responding to light or to movement? And if all of that's, those are the ways we kind of filter out some of the other more common causes. And once we realized there was some cognitive issues going on, this patient was put on a combination of medication, similar to the ones we used before office visits, but at a lower dose to kind of just help with some of the general anxiety. A food that can help support, brain health and, just kind of help promote health for longer.
I just want to interject here because I did have a client whose dog clearly had CDS, and he put him on one of the diets. I'm just going to do a plug here. It's called BD, and it's produced by Hills. It was a 180 in the dog. He said, this is a miracle diet. It saved his dog, as far as, he was concerned. So there's lots that can be done diet-wise too.
And then this particular patient was put on a supplement. I believe it's Semilife. There's several different supplements though. And, using that protocol, this owner was able to see like a significant improvement in how comfortable her pet was. He seemed to be more himself, more interested in playing, whereas some of that stuff had gone away. And of course, these conditions can be progressive and chronic. We're trying to slow down those progressions. So when we see improvement like that, we're happy to get, a better quality of life for these guys, as long as we can.
One of the things we did want to mention too are consistent routines. If you've ever had a parent or a grandparent who you knew were going through some of these issues associated with Alzheimer's or just general age, making changes in their routine can have a big impact on them. So trying to be as predictable as possible with the time that they're being fed, the time that they go out, that's going to help them along too. Talk about medications, supplements. Again, I'm going to go back to those omega fatty acids. Good for us, good for them. So that's also a possibility too. And I think that's everything we have.
And environmental enrichment.
Environmental enrichment, yeah, we got to talk about that. Okay, so here's the thing. You have your dog hangs out in the house all day long. Their brain isn't being stimulated. This also helps for cats because environmental enrichment is a huge thing that we're going over in our feline patients now because they need to be stimulated. If they were outside, they'd be hunting, they'd be watching butterflies, this and that. And there are inexpensive methods that we can use in order to keep them, their minds going. There's lots of puzzle games that you can find online, but there's a lot too that you can find that you don't even have to pay for it. you know, that you could just concoct that of things that you have at home.
Or towel.
Yeah, I mean, there's so much that you can do, and that the more you do that, again, just like in a person, they start doing, you know, crossword puzzle. They start interacting, you know, their brain lights up, and that's what we want. We don't want that brain to just continue to decline. We want it to be, it's elastic. The more you use it, the better off you're going to be. So that's what we're trying to focus on.
Before we start dental care, are there any questions on the previous section? I know that's kind of a hot topic for a lot of people. You can either jump in or put it in the chat or save it till the end.
Woo!
Okay. Okay. Whoops.
We're talking about dental. So I am so passionate about dentistry and how it affects pets because I've seen how much it helps them. I can't tell you the number of cases we've had where the pet comes in, we've cleaned up their mouth, and he's like a kitten again. He's like, you know, he's like a puppy again, because those types of, that type of oral pain, they don't show. Dog will still continue eating. A cat will still continue eating. You may notice maybe the cat chews on one side rather than the other, but they're still eating. So everybody's like, oh, everything's okay. Go by odor. If there's an odor in your pet's mouth, there's something wrong and they should be looked at. It may just be the early signs of periodontal disease, and we can do some things in order to help mitigate that and prevent them from having to come in and have their mouth cleaned up. Many times, though, these guys, we just had a dog today, 21 extractions the dog had to have, and half of them had abscesses of the roots. So this dog was probably in a lot of pain for a long time. Naturally, the owners are very upset. Naturally, they feel terrible. But this is why we're here, and this is why you're here, so that you can identify sources of this. Think about odor. If there's an odor to your dog's breath, if you're like, ugh, or if you don't want your dog to kiss you, whatever it is, there's probably something going on there, and at least have them looked at. 80% of animals who come through our doors have some degree of dental disease. When I say dental disease, that doesn't mean that, oh boy, here's like a gigantic bill that you're going to have to pay because we have to come in, we have to have the teeth cleaned. No. These are things that we can start to address beforehand, and there's a lot of products out there, like at least 3 dozen that I can think of off the top of my head that can help with those types of problems long before we need to have them come in and have them sedated. Dental disease affects their heart, it affects their kidneys, it affects their immune system. Their white blood cells can go down. I mean, it's chronic inflammation. That chronic inflammation is also not good for them. It can wind up causing other types of disease. I'd have to say, I mean, you put 0 visible pain. Very, very rarely do we have a pet come in who's showing overt signs of pain. Mm-hmm. We have had dogs who have just broken their tooth. So the nerve is exposed. You could see it there. It's going, hello. And meanwhile, the dogs come in and they're like, woohoo, life is great. But you know what? That dog is in pain, and that needs to be addressed. So dental disease is something I always tell clients when they come in, and if you're a client of ours, you know this, the 2 best things you could do to keep your pet as healthy as possible and as happy as possible long into their geriatric years, keep their weight down and take care of their teeth.
And just about, just want to mention about cats in particular. So they're also incredibly good at hiding pain or discomfort. They're not typically going to stop eating until their dental disease is very severe. There's some, you know, the signs here, but this is some oftentimes when it's fairly advanced, and cats can get something called a resorptive lesion, which a good percentage is below the gum line. Like you're just not going to see just by taking a look in there, but they can be extremely painful. They basically make the like Swiss cheese holes in the teeth. So, you know, the process of that tooth disintegrating essentially in the mouth is very painful. And cats are just, while they're predators, they're also prey to some things. So that's why they're, you know, they've been engineered, so to speak, to hide any problem, so they don't, you know, become obvious to any predator. So that's just stayed with them, and they just don't show us until, you know, basically they come in for an exam and we try to look in there. So
yeah, I mean, even when it comes to odor, particularly for cats, I mean, look, I'm kissing my cats all the time, so I know what's going on in their mouth. But even myself, though, I mean, I have them come in at least every 6 months, and I'll see changes that I'm like, ooh, I didn't know that was going on. They may not have the odor that dogs do. Maybe it's because dogs are constantly in our face and they're panting and, you know, I love cats and dogs.
Yeah.
Dogs are a little bit more rude than cats at times. So cats may not have that overt odor unless you're really getting in there and giving it a good whiff. But Christy had a good point about those resorptive lesions. It's a very common condition that you can see in them. And for something like that, it's going to require a physical exam for us to identify, because as those holes are being created in the teeth, you have exposure to the nerve, and that's super painful to them, even though they're not showing it to you. Signs of dental disease. We already talked about bad breath. Dog breath is not normal, okay? Cat's breath being abnormal can also be, and I'm not even just talking about dental disease. If you're having an odor to the pet's mouth, there's a lot of other conditions that could be going on. You know, diabetes, kidney disease. These are some of the things that you can recognize on their breath. At least the trained veterinarian can. That need to be identified again long before you feel like you're noticing a significant problem. Dropping food, you can see that sometimes. Again, cats, probably the biggest thing I've noticed that clients will say, I noticed he's when chewing on one side of the mouth, pawing out the mouth. I see that more with an acute problem. It's like a pet that, you know, has broken a tooth. Oh, let's talk about bones, okay? Antlers, those really hard bones. Yes, they love them. Of course they love them, but they're bone. So it's bone on top of bone. The most common tooth to be broken in a dog is number 108 and number 208. They're gigantic teeth. They have 3 roots, and when they're broken, they have to come out this way, laterally. It's kind of a major surgery. So as a general rule, I'm talking as somebody who's interested in veterinary dentistry now, if you put your fingernail in it and it leaves a mark, it's safe for your pet. But if it doesn't leave a mark, technically, it's an issue. Now, I'm also a client, and my German Shepherd loved his tennis balls. Tennis balls were wearing down his canine teeth. I knew they were. I love my dog. I knew the consequences, so I kept giving him his tennis balls. So you're warned. I would recommend that you don't, but if you do, keep an eye on those teeth to make sure you're not seeing fractures. Way that you might be able to notice there's a fracture of the tooth is if you see an abnormal accumulation of tartar on the back teeth. So if you're like, hey, his teeth look great, but wait, that one tooth looks pretty brown, that might be an indicator of something called a slap fracture. So keep an eye out for that. Behavior changes. So I just, again, we do a lot of dental work here, and I just had a kitty come in. The cat needed full mouth extractions because it had an underlying condition that required it. The owner said, I had no idea how much pain the cat was in. And she said, I learned a lot about him because he'd been hiding under the bed. He was very cranky. He wouldn't sit with us. And of course, it was something that was gradual. And once that pain was removed, she was like, he's like a different cat. That's not the first time I've heard that. I've heard that dozens of times, which again is one of the reasons why I'm so passionate about dentistry.
We had one question. Is dental care covered by most pet insurers?
It depends. When it comes to dental disease, if the pet has periodontal disease that had been previously diagnosed by your veterinarian and it wasn't addressed, they likely are not going to cover it because they feel like that's something that you should be doing to take care of your pet on a regular basis. Fractured teeth are almost always covered. I do have a couple of patients who have juvenile periodontal disease, and those were absolutely covered because the dog was a year, maybe even less than a year, and needed a dental cleaning, so those are covered. So it really depends on the pet insurance carrier, but it also boils down to, and that's kind of the little thing you need to keep in mind about pet insurances too, because if we make a recommendation and that turns into a big problem, they may not cover it. I haven't really seen that, but that is in the fine print. So when it comes down to the dental disease, my recommendation is have the mouth cleaned up, and then take care of it moving forward, because some of these companies too, you can, if you've had a perfect dental exam going forward, they will sometimes allow it if there's something else that's going on down the road, because they feel like you've resolved it, you've taken care of it, and now this is something else, and they'll address it. So I hope that answers your question. But as a general rule, periodontal disease is something that should be managed by the owner, and that's what the pet insurance companies are saying. I do have one company though that did say that they cover it. I'm sorry, I don't remember which one it was, but that is few and far between.
Yeah, they're really, I don't think any really cover any pre-existing conditions of any kind. Other than there's a, you know, major differences, probably some do more routine wellness and some don't do that at all. One thing to note is if you are looking for insurance, just consider if it has a deductible for each condition or for the year. Because if it's for the year, you might be able to get in your, you know, your dental treatment or when you've already been in for something else that year, you don't have to pay that deductible all over again. So just something to consider when you're trying to plan for when you do it, if you were, how your insurance company works in that regard.
I think at some point we are going to have another webinar on pet insurance because there are a lot of things that I think is super important for you guys to understand. The one thing I want you to walk away with as far as pet insurance is if you have a dog who's like 8 years old, number one, don't drop your insurance. And number two, if you change insurances, anything that pet had been diagnosed previously, whether it was a urinary tract infection, whether or not it was allergies, right, will not be covered by your new pet insurance company. So just kind of keep that in mind. But we'll do another webinar, so keep in mind that. Good question. Dental care options, yes. So we do something that we call a cohat. I mean, again, I graduated in the 1800s, and what we would call it a dental. What we did back then is far different from what we do now. And the thing that changed everything was dental x-ray. Because we would clean teeth and I'm like, hey, it's well seated in there. We'll just clean it up and it'll be fine.
That's okay.
Well, yeah. Well, you know what? The periodontal ligament is gone. That tooth, the tooth root is affected, and that tooth needs to be extracted. So 6 months down the road, now that pet's going to wind up needing more dental care. So we call it a COHAT, which is complete oral health assessment and treatment. They're also sometimes called an oral ATP. They're the same thing. We have been making a concerted effort to try to get clients to come in to have the teeth cleaned up before you need extractions. The price difference is astronomical. So just cleaning the teeth and not needing any extractions is far less expensive than when you do, because dental extractions are a surgery. It's an oral surgery. They have to come out laterally. Very few, unless they have one root, they can come out this way, but there's only a few teeth that only have one root. And then home care. Hey guys, we do something way different from other veterinary hospitals. You come in, you have the pet's mouth cleaned up, and then we have at least three included dental progress exams. This is where I see your pet 2 weeks later. We make sure that everything healed appropriately. Then we teach you methods in order to keep that pet's mouth healthy going forward. It drives me insane when we have a client who's gone out, they've had the pet's teeth cleaned, and they're like, bye-bye, and there's no follow-up, because that's going to come back. So what we do is we do that 2 weeks, then we have another one, and typically we have a third one. Sometimes I even have another one. I don't want to release you until I feel comfortable and you feel comfortable that you have a handle on how to keep this mouth healthy. Occasionally we have clients and we have pets that's just not going to happen. But at least at that point, we know that we've tried everything that we could, and this pet is going to have more cohats in the future, because they just weren't amenable, or it just wasn't something that the owners were able to do.
Any questions on dental before we just bring it all together?
Cool.
Okay.
So just to recap, your senior pet care plan, have them come in every 6 months. You know, that's when you start to catch things way earlier and you can address them before they become a major problem. Routine diagnostics, again, at our hospital, we have a wellness panel at least once a year, and that is very comprehensive. Over the age of 3, it includes a urine. Of course, it's your heartworm test, testing for Lyme, Ehrlichia, anaplasmosis, which are all tick-borne illnesses, kidney values, liver values, so that they are pretty comprehensive, and they're reasonably priced. Mobility support plan. So if your pet is diagnosed with an underlying arthritic condition, we can help you to identify ways that you might be able to make changes to your home. For instance, I'd gone to a webinar on mobility management in senior dogs. They had so many great ideas. Like, you know, people will buy mats to help dogs because they can't get the grip, particularly if you have hardwood floors or in the kitchen. But also there's a roll of yoga mat that you can get that's relatively inexpensive. So if you have a larger area that you need to cover, you can use that and cut it to the length that you need it to be. and that certainly helps them. Places you definitely want to have a mat for them is in front of their food and water bowl. And if it's an area where they have a tendency to be with you. So if you have a living room where everybody kind of hangs out and it's a hardwood floor, make sure that they have something where they have grip. There are so many things. There's nail caps. Oh my gosh.
Oh, the little pad stickers.
There's so many things. Look at the
Yeah.
Let's see. Mobility support plan, cognitive mentoring, monitoring, huge. So look back at that DISHA and start monitoring your pets. Are you seeing this? You're seeing that? Keep in mind that, is this a pain problem or is it a cognitive problem? Because you can make your pets' lives better if certainly if it's something like that. And then dental care, I'm big on that. The sooner you get them started on a good dental program, the better for everybody. Sometimes I flip the lip on like an 8 or 9 year old dog and I'm like, holy crap, got the best teeth ever.
Yeah.
And then like a Chihuahua, like my Chihuahuas down here, Chihuahuas, Dachshunds, dogs with a beard, terriers, they all have a tendency toward very bad teeth. So make sure that they get looked at, whether you're a client of ours or not, make sure that you get that mouth looked at and give it away.
And I know we covered it briefly about the organ effects it can have on liver, kidneys, heart. I mean, if you think about it, the body is constantly fighting infection. Like if you had an infection somewhere and you just never could get rid of it, and your body was working hard to deal with that all the time, and then that bacteria is in the mouth where the bloodstream is. That blood is also circulating through the rest of the body. I just never realized until a few years ago just how much of an effect it could have. So just bear in mind that we want them to be comfortable, and that's a major part of why we're so passionate about dental care. But we're also looking at longevity, improving, and Dr. B says it in rooms all the time. How do you promote a good quality of life for as long as you can? Take care of their mouth, take care of their weight, and those are, it's true. We see a lot of good outcomes when people take care of those.
Makes a big difference. There's something else I wanted to mention about dental care, but it's gone.
We had a few questions that came in, so maybe you'll remember it in the meantime. But one is, what dental chews do you recommend?
I would recommend any dental chew that is certified by the Veterinary Oral Health Council. If you Google Veterinary Oral Health Council or VOHC, they will have a list of products that are approved for cats and for dogs. So that's what I would recommend. As a general rule, it's better to brush. Chewing is, and look, brushing isn't as difficult as you think. They have lots of chews available. There's water additives. There's lots out there, but make sure that they're certified because there's a lot of garbage out there that's doing absolutely nothing.
And is blood pressure taken routinely in a 6-month exam?
It depends on the patient. For instance, in a geriatric dog, yes. Particularly pets that have kidney disease, yes. So it is not done routinely. So I guess that's the answer that I have for you. It should be, but unfortunately at this point, because so many people are unfamiliar with the fact that the pet can have hypertension, it's not.
Okay. Is howling a normal condition in older cats?
No. Howling can be a sign of a lot of different things. It's almost never just because they're howling. It can be anything from anxiety. Cats who are howling can also have thyroid problems. Cats that are howling can have underlying pain problems. But if it wasn't always a howler, like a Siamese, that's not normal and the pet should be examined.
Okay. Can you send us a list of recommended glucosamine and omega-3 supplements for older cats?
Absolutely. I think we could do that. Yeah. I'm sure Barbara could do that.
Yeah, you get it to me and I'll send it out to everyone. So let me just make a note of that. Okay. And can you perform, this is a good one. Can you perform because you'll see why. Can you perform a dental cleaning without putting the dog under anesthesia?
Oh, I'm so glad you asked this question. That is verboten.
Yep.
If you do any kind of research on it, you'll see that it's almost malpractice to do that because you're not addressing what's underneath the gum line. 60% of pathology is underneath the gum line, which you will not be able to see. Plus, the pet isn't going to allow you to touch those areas because they're very sensitive. So people who go in and they go, oh, look, the mouth looks so much better. It's not. This pet that we had today, I had to go back and re-look at the x-rays because I'm like, those teeth look great after we cleaned all the tartar off them, but they're not. They had abscess roots and they needed to go. So do your research. Anesthesia-free dentistry is not recommended and it's almost considered malpractice. It is not cleaning the mouth.
Okay. Just a few more slides here, and then we can take more questions. Go ahead.
Okay, so you want to go ahead, Christy?
Oh, sure. Okay. Our philosophy, you know, every decision we make is guided by a set of core values. We really care about the comfort of your pet. So how your pet feels every day and how many good days they have is really important. We prioritize that when we're thinking about their whole treatment plan. You know, it's not a one size fits all here. We do really customize everything we do for your pet.
Even when it comes to vaccines, you know, sometimes people go, oh, they need this, this, and this. Not necessarily. You know, if you're living in, you know, a high rise, or if you're in a complex where your pet isn't going places where they don't have exposure, we don't recommend certain vaccines. Also, when pets break over the age of 10, as a general rule, we no longer give the distemper vaccine. And the reason for that is because typically, if they've been a well-vaccinated dog, they have more than enough immunity. Should the odd occasion come where they come in contact with one of those, they should be able to fight it off. So it's definitely not one size fits all.
Early detection, as we mentioned several times, catching the problems before they develop, and when we still have the greatest opportunity to intervene and offer a number of different ways that we can either slow down the progression of something chronic, or in some cases, you know, eliminate an issue altogether. One thing I hear frequently is someone will say as like their cat gets older, oh well, he's vomiting or something, and he's just a cat. Cats vomit twice a week, or cats, you know, something like that. But when we see them, we're able to do more education, we're able to do more routine screenings, we're able to do more physical exams, and oftentimes like what might seem like just typical for a pet is something that we can do something about. So I mentioned the individualized care. So, you know, that's true from, you know, not just cats and dogs, but, you know, from dog breeds. Different dog breeds have different concerns, different issues.
Oh, Frenchies.
Yeah,
we do a lot of French Bulldogs because we work with French Bulldog Rescue. So, boy, they are a different animal for sure.
Yeah, they're like, when you even look at some insurances, they'll have like breed specific conditions that they just don't cover. I mean, so that's another thing to note about that.
That's true.
But they're specific enough that in certain issues are seen in more breeds over others often enough that we need to be aware of it when we see your pet, and we're well aware of what those are. And we want to work with you. I mean, we want you to have. We so value the trust that you place in us. We strive all the time to make sure we're worthy of that trust, that we continue to deliver high quality care, really thorough care, individual care, and you always feel like you can reach out with any questions that you have, any concerns. If there's something even in between, you want to call and say, hey, I'm starting to see this. Is there something I can start giving now? Yeah. We're happy to help you do that, you know, anytime.
I also want to address the elephant in the room, which is cost. Okay, so when your pet comes in, we're going to recommend what we feel is the best for your pet. We understand that, you know, prices are going up and not everybody could afford exactly what perhaps might be the gold standard for your pet. Talk to us, because there are things that we can do that might be a little bit less of a cost, but we can still achieve what we're trying to do. So let's have that kind of conversation. Let's have that communication, because we want your pet taken care of. Don't avoid bringing them in because you're like, oh, it's going to be this and this and that. Particularly if you have a financial issue, come in and say to us, you know what? I just want them checked out. I want to know what's going on, and then we can create a plan for you. You know, we're here to help you, and we're definitely here to help your pet.
And that was a good segue, because someone else had just said, because of the cost, it would be very helpful to have the webinar on insurance. So we will do that next, I think. Good.
Sorry.
I know.
Oh. Okay, so if you feel like something's off, don't hesitate to reach out to us. Whether it's a phone call or an email, it's it's the middle of the night, you're like, I don't want to leave a voicemail, send us an email. Our emails here are checked dozens of times a day, and we will get you an answer. Whether that answer might be, we need to see the pet. That answer might be, how about try this, this, or this. Changes in appetite or weight. A cat that doesn't eat for a day is serious. If it doesn't eat for 24 hours, it's an emergency. That's very, very important to understand. Behavior changes, increase in anxiety and confusion and aggression. Did I mention the German Shepherd? The German Shepherd? So we had a German Shepherd come in who started biting the children.
Oh, no, you didn't.
Oh, okay. So we had a German Shepherd come in, was becoming more aggressive, was starting to bite the kids, and they were wondering about putting her down. And, immediately when I saw the pet come in, I knew that there was underlying osteoarthritis. Then when I put my hands on him, I could see that there was muscle wasting. We did, I think it was only a 2 or 3 week trial of just a non-steroidal. They came back in for the recheck. The dog is fantastic. So they got their dog back. And I mean, that alone is worth everything in the world, I think, to most people. Mobility decline. There's so much that you can do at home. Those mats are important, to keep them from sliding. There are these little, they're called Dr. Busby's toe grips that you can use on them. Cats are very interesting because as 90% of cats over the age of, I think, 7 or 8 have radiographic evidence of osteoarthritis. Cats, I just had a cat in, it was a geriatric cat, and when we were trying to get the x-rays and they would stretch the legs out, the cat would cry. When they were getting the blood, we get it from hind leg, the cat would cry. This cat clearly has osteoarthritis that needs to be addressed. And there's lots that you can do for osteoarthritis in cats now as well. So if a cat no longer will jump up on things or takes a double step before they go up, also if you see the cat kind of slides down before they jump off of something, they kind of like take their time. These are all indications of pain. If a cat is very overweight, a lot of times they'll have severe arthritis in their elbows or their knees. And this is like an area that a lot of times years ago, we would kind of just gloss over. We didn't even really palpate them. And now we're like, holy crap, they're very uncomfortable and we could do something about it. Accidents in the house. If your pet has been well trained and now they're having an accident in the house, there's a problem. It could be anxiety, could be CDS, could be urinary tract disease, it could be kidney disease. Urinary tract disease occurs quite often in senior pets. And I think a lot of it has to do with the fact that, let's say your dog goes outside and he pees and nobody really sees it. Or you're living with the pet and you don't notice the odor. We've had pets that come in and we could smell that they have a urinary tract infection. You're living with the pet. You might have a bigger house where it's dissipated and you really can't notice it. So these are some of the things that we definitely watch out for. Bad breath, we already talked about that. I don't need to bore you anymore with it.
Okay, and a general question came in from someone. I recently found 2 ticks on my golden retriever. I was able to pull them out. When should I bring him in for a blood test for Lyme disease?
I would wait at least 6 weeks before you bring them in for the test. And a lot of people too, when you're removing the tick, you might go, oh, the head is still in there. Don't worry about it. Because, all right, you've decapitated it. It's dead. As the pet is dead, it's going to release its mouth parts, and anything that's left in there is going to fall off. We see more issues with people trying to dig in there and get out everything that they think is in there. So take it off, put some Neosporin on there or some kind of topical antibiotic, and then have them tested for Lyme about 6 weeks down the road.
Okay.
And hopefully the products the ones that we use and the best products, they're not going to repel every tick. We want them to kill the tick before they can transmit disease. It does take some time for disease transmission, anywhere from 4 to 48 hours, depending on the tick-borne disease. That's not to say we should still test because, we just want to, it's hard to say sometimes when that tick went on. But yeah, we definitely want to, make sure that everyone knows that, like, if you see one, if you're giving products once a month all year long, and the ones that we have once a month, it will kill the tick most likely before it transmits disease.
Also, in our area, probably the biggest issue we have with infectious disease is Lyme disease, anaplasmosis, Ehrlichia. These are super common, and we are just inundated in this area. If you're finding a tick that is large enough that you can pull off, that's a wood tick. They can carry diseases, but not so much as the deer tick. The deer tick is the size of the head of a pin. So chances are you're not going to see that. However, you're seeing those other guys, chances are you're probably having deer ticks as well. So that might be the time that you need to rethink what you're using as far as a flea and tick preventer.
Okay. The question came in for me. Is there a way we can get a copy of the PowerPoint slides? So the answer is yeah. I will send that out. Any other questions? You guys can feel free to unmute if you want to ask it in person or put it in the chat. I mean, this has been, whoops, another chat's coming in. This is great. Oh, Amia says, woof, thank you, woof. Any other questions? This has been great. Yeah, I will be, the video of it, oh, another chat is coming in. I will be putting the video on YouTube, sending the link. Another thank you came in.
I hope you guys can recognize that we're here for your pet. We're an independent practice. We're not corporate. That means we don't answer to shareholders. We answer to you. We answer to ourselves, and we answer to your pet. We care. And that's why we put these things on. There's going to be more webinars in the future. If you feel like there's something that you want, for us to talk about, because I feel like something like this is we can get to a lot of people, whether they're a client or not, and kind of go over some of these topics that might appeal to you.
All right, Lewis and Clark say thank you. Everyone's checking in.
Thanks, Mr. Gabelli.
Yeah. All right. So I think we'll wrap it up. This was perfectly timed. Boy, this was great. 6:57. So thank you everyone for attending. We will share the information and we will let you know when the next event is. So
have a nice
thank
night.
you. Thank you.
Thank you, Christy.